Extending from 4 universities and across the state of Missouri, University of Missouri Extension offers real-world, hands-on, research-based approaches to some of the most pressing challenges in Missouri, including agricultural growth and stewardship, workforce and community development, and educational access. In this segment, our MU Extension experts discuss issues surrounding health and well-being in Missouri.
So what is health?
What is health?
What does it mean to be healthy?
For me, it's being physically, mentally, and emotionally happy and healthy. It's got to be everything, not just your physical health. Or if you have your physical health, that's great. But if you don't have good mental health, you have to have all of it to be truly healthy.
I think there's more, though. You have like financial health is part of your health. Health literacy is part of your health. Knowing how to take care of your health is part of it too. People have spiritual health. There's all sorts that go into it, but I think you're right. It's all encompassing when you talk about well-being more so than health.
In addition to that, just the value of the social belonging probably contributes to our overall health and well-being as well.
I think having access to all of the things that you need to be healthy, whether it's healthy, nutritious food, health care, social connection, that those are the things that I think make up health for people and for me too.
And having access to those resources so that you know when you're not healthy or when you are struggling with your mental health or your financial health, that you know where to get help.
I think another component could also be like your social health. Having that ability to have people around you that are your champions that can also help you make good choices and want to be healthy, to live longer lives for your family, your friends, your community.
I think it's about feeling good in the different realms of your health, so physical, mental, emotional, how you're connecting with other people, and then also being able to function well, close to your full capacity or meeting it.
I think at an individual level, health could mean having the things that, being able to do the things that you need and want to do in your daily life, and that differs from person to person.
So what is the difference between health and well-being?
I think that among the public, especially, there's a difference between the two, because when we say health, we associate that with the medical model, which means health care and going to the doctor. And so we kind of separate that from all of the preventive things that help us to get and stay healthy, and maybe avoid having to get a lot of medical care. So I think it's a kind of it's the nuance of the wording that we use. And when we say well-being, we tend to think of that more holistically as being overall, feeling good, good nutrition, being healthy, as opposed to unhealthy and needing to go to the doctor.
Like the definition, I believe, I looked up before we came, the well-being definition is being comfortable, healthy, and happy. So you can be physically pass all of your physical exams in the epitome of health via a textbook or what your doctor tells you. But if you're not happy, are you healthy? Do you have a good well-being? Do you have a good sense of well-being? If you don't have, a safe home environment but you're still internally healthy, there's a difference between health and well-being when it comes to things like that.
I also Googled the definition prior to our talk, and it says, health is the absence of disease or illness. And so it feels a little bit more rigid to me. Whereas when I think of well-being, I think of more of it's a spectrum, and we're constantly fluctuating where we fall within that, and trying to move, more to the more into our wellness versus away. But we're it's a fluctuating thing.
I like that you said it's a spectrum.
I love that.
How would y'all say Missouri is doing in the areas of health and well-being?
We have a lot of work to do, particularly in rural areas where there's less access to those resources that we mentioned earlier. that provide us opportunities to be able to access medical care or access health, behavioral health resources.
People in rural and urban underserved areas typically have their social determinants of health, which is housing, education, access to health care. In addition, health behaviors are usually worse in those areas. So like Chiquita said, we have a lot to do, especially in rural and underserved areas, because they don't have access to fix their or address their social determinants of health or their physical health.
There are great disparities from one part of the state to another in length and quality of life. So for example, down in the Boot Hill, the county with the shortest life expectancy, it varies from the county that has the highest life expectancy. Even within our state, there are counties that are doing pretty well, and then there are those who are far, far behind the others. And so there's a lot of work to do, particularly in those rural areas.
I think we've talked a lot about like individual health. You asked about the well-being of a person, and we talked about all those characteristics, but community health plays into the differences in counties and things like that too. So if your community is set up to create safe places to be physically active, or having physicians in the area or other specialties in the area, things like that contribute. The community health contributes to your personal and individual health.
So from one of the research that I've been looking at, Missouri ranks in the bottom 40 out of 50 states. And so that's, I guess you can kind of determine like that's where the Missourians' health kind of lies. Bottom 40, that's a ways up to go to get us healthier.
I heard you mention the social determinants of health. What does that concept mean, and what are the social determinants of health?
Social determinants or drivers of health are factors where people are born, where they live, where they grow up, where they work, that are outside of an individual's control but have a large impact on their day-to-day health. Many of them are environmental, so we think of environmental factors as being outside or the built environment, but sometimes it's the food environment that impacts the choices that we make. So a quick example from my life is that the church that I attended was having a breakfast every Sunday. They always brought food, and it was always donuts. Always donuts. And there weren't any other options. And so, in between Sunday school and the 11 o'clock service, people get hungry. And so if they were hungry, they were going to eat those donuts. So not a lot of options. Then we started bringing in fruit, and the teenagers would go to the fruit before they ate those donuts. So that's an example of the food environment determining what you eat because you have access to one thing and not another. There are entire communities like that.
I like another example on maybe a physical health side is, you can grow up in a rural part of Missouri and have no place to walk your dog or push a stroller or use a wheelchair because there's no safe sidewalks. So, the city's infrastructure can affect your personal health if you don't have a safe place to do so. So, yes, I want to be outside and I want to go for a nice walk after dinner, but I'm going to have to do it on a county road with farm trucks flying by and no shoulder, and things like that. So I think that's another example of the environment affecting your own physical health.
That reminds me of how every issue really is a health issue. So in that rural environment where you're walking on a road that might not be safe, there are other examples of maybe stray dogs being out, even in cities. And so in that example, stray dogs is an animal control issue. Animal control is a health issue when it prevents people from doing what they need and want to do to take care of their health.
There's food deserts, childcare deserts. People don't have transportation. All of those things affect whether or not they can go to work, eat healthy food, have somewhere safe to have their child taken care of while they're at work.
And you asked us about the difference between health and well-being, and I think this is sort of where the rubber hits the road, because when we think about health, we think a lot about a person's individual abilities to impact their health, or that health is between someone and their doctor. And I think well-being really asks us to consider all the other things that are impacting a person's health and in their life. So if you are going to the doctor to get treated for asthma, and they give you an inhaler, they're not necessarily treating all of the environmental factors that are impacting that, or that you live near a factory that puts out pollutants, or that you can't get to your prenatal appointments because there's no bus system and you don't have a car. So I think we tend to put health in a place of blame on people if they're not doing well, and the social drivers ask us to think about all the other things.
We're the health and wellness people, but the ag people are in rural communities every day, and they see changes in people's mental health, or if they're losing weight or gaining weight. Extension can have a positive impact on health and well-being, regardless of what the program area is.
That makes me think about health in all policies, because health is really integrated into every aspect of our lives and everything that we do.
How do we help people get more comfortable talking about their health? And then the second part, how do we help people get more comfortable advocating for themselves?
One way I think we can make people more comfortable talking about these topics is to take some of the shame away. And so I teach nutrition and health, and one way I think we can improve in that area is to stop referring to food as good and bad, and oh, I'm cheating because I ate bad food today, or oh, I'm so good, I've really been on top of things, I exercised every day. Because that shame that gets put on you when you are making the less healthy option, it's not helping you to make any healthier choices. So it can sometimes cause people to spiral downward, or to shut down and not share and be honest about what their choices really are and their barriers. So less shame, less stigma around some of these topics would be really helpful.
I think just treating people with civility, and as Mel said, not shaming them. Don't ask them questions based on their appearance. You have dreadlocks, your physicians shouldn't say, "What drugs do you do?" If patients are treated with civility and actually listened to, I think that builds up the trust. Patient outcomes increase if the patients trust their provider. Patients advocate for themselves more if they trust their provider.
When you think about substance use disorder, also reducing stigma around mental health access, it will be huge in people being able to access those resources. The more we can improve information or educating people on how to be resilient might impact their health outcomes as well.
I found that people were pretty willing to talk about their physical health, sometimes too much so, considering the professional relationship. But people are much less willing to talk about their mental health, and that's something that we've got to change. Mental and physical health are interwoven. One affects the other. And I think that one of the ways that we do that is by being more open ourselves as extension professionals, and being willing to share our own personal story so that it normalizes having bad days or needing to seek help.
I also think extension programming is also set up, a lot of them are group programs. So when we teach in nutrition and health, and you sign up for a class on mental health or diabetes, you know that everyone else in the room is also having the same struggles you are with their mental health or with their diabetes. So you can, if you have the vulnerability to show up to an extension class, you can guarantee that everyone else in the room is experiencing the same thing. That can help normalize the whole situation, and you'll be more open. The conversations and the discussions that happen within those classes are really vast and deep and vulnerable. And I think that means a lot when we're talking about reducing stigma and normalizing things like chronic conditions.
If you were to distill it down to the top, maybe 2 to 3 barriers that make it difficult for people to achieve higher levels of health and well-being around the state. What would you say those are?
I would definitely say number one is transportation. I think it's a huge issue in our state, whether you live in an urban area or you live in a rural area. That is a barrier to healthcare and access. And then we also have a healthcare shortage of professionals across the state as well. I would say that's number two in my mind.
So you mentioned transportation, which is a social driver, but it also impacts whether you are able to access good clinical care, like as you just mentioned. And I think it's important to note that for people who don't have transportation, it's very difficult for them to follow through on their care plan. So let's say that they are sent to physical therapy twice a week, but their physical therapy office is an hour away and they're having to borrow a car. It's going to be extremely difficult for that person to follow through. So all of these things are really connected in ways that sometimes we don't recognize.
I would also say accessibility, because Missouri is such a great place, but then we have a lot of rural areas, and there's not enough practitioners in those rural areas with specialties that can address, everybody's health disparities or health issues. And so again, transportation, they either have to drive far distances to get the help that they need, or, if it's in town, it might be something that it's too expensive for them to afford. And also I would say another thing is the lack of insurance coverage for a lot of individuals that can't afford to have commercial insurance or don't work, or they're not old enough for Medicaid or Medicare.
A couple other things that I think about in terms of access to healthcare. As a mom of three, being able to access affordable childcare is definitely an issue. And, if I'm trying to get to an appointment, but I don't have anyone to take care of my kids, that makes it pretty hard. And also with that, work sites that allow the flexibility to be able to take time off, take days off to pursue those doctor's appointments is another issue.
I would add health literacy is a pretty big barrier. We've noticed, folks their doctor will say, you're diabetic, don't eat sugar, cut your carbs. And there's so much more to it, right? And some people don't know what they don't know. They don't know to ask the questions, the follow-up questions. Can you be more specific? Can I talk to someone else? And a doctor doesn't have time to take you through 6 weeks worth of a program of how to manage your diabetes in one session. So learning about how to manage your own health and knowing how to ask the questions and not being afraid to, or not being afraid of the stigma and things like that can be a big barrier.
Do you have access to healthy food? Do you, like Janelle said, do you have access to a place to walk safely or to work out? Those are the things that they come in, they see them in the office, and they don't necessarily talk to the person about holistically what they have access to.
To add to that, living alone and the social isolation that comes with elderly people, I will say from my own personal experience, knowing that my mother is getting older, her mobility is lessened. Trying to go to the kitchen and cook a meal, a full, healthy meal, the way that we suggest is not feasible. Standing for long periods of time, those are challenges that our older populations, we take for granted, and they are dealing with that every day.
Social isolation is huge, and the U.S. Surgeon General released a report last year that talked about how dangerous social isolation can be in causing premature death, and equated it to the same risk as smoking up to 15 cigarettes a day.
What role would you say local government has in addressing these barriers?
Well, we talked about social drivers. We described them as being things outside of an individual's control, but decision makers locally can have an influence on the things that an individual person can't. So I think it's important for those in positions of authority to educate themselves about factors they may not be aware of that impact the health of their entire community, and not just the factors that we look at as an individual's behavior and their individual responsibility.
I mean, I can go back to the physical activity example of making sure your local government has policies within planning and zoning. If there's a new road being built, it needs to have, a protected bike lane, a sidewalk that's accessible for wheelchairs and strollers, that's maintained, it has lighting, it has trees and things like that. So your local government protects all of that for the whole community, and that will in turn impact every individual in that community's health.
And the local government has a lot of influence, so they can bring people together to start these conversations, to build the momentum to make lasting change.
Missouri is working on reimbursement for child care providers, making sure that they can make ends meet. Homelessness in Columbia has been a discussion item for Columbia in the last several years, using the ARPA funds and other funds to build additional affordable housing. But again, getting someone that's homeless into a home, that's great, but you also have to address any mental health issues that they have. So I believe that local governments that listen to and understand the problems in their community can be extremely effective. But again, I think Columbia is not the same as other cities that are smaller and have less resources. So that is more at a state level or even a national level to address some of those issues.
And so important, because those local governments, like you were saying, have access to listening to their direct constituents. All of these social drivers that we've been talking about, a lot of them were put in place because the people in power were acting out of what they saw the world as, or their own interests and their own needs in their communities. And a lot of times that creates problems or systemic issues for other people in our communities. And so listening to everyone so that we can really understand the big picture can really help us fix some of those systemic issues.
So let's say I am an elected official, and you want to convince me to focus on investing in the health and well-being of my community. What does that conversation sound like? How do you have that conversation with an elected official in their community that compels them to want to invest in health and well-being versus workforce development or youth development or some other area?
You're investing, today's investment is something that will influence the health and outcomes of people for generations to come. Your investment today can lead to opportunities for people to have greater access to the resources that they need, education, health literacy, and also nutrition.
Community health is interwoven with economic development. If we don't have a healthy workforce, then businesses won't want to locate to areas. If we don't have good education, which is a driver of health, then we don't have a developing youth workforce that can go in and work for employers. So investing in one, it doesn't mean that you're excluding the other. They are all inseparable.
And I think there's levels. So, someone can start with basic needs too. That's not like this massive undertaking, but basic needs need to be met in your community. So you can start with housing, you can start with education, you can start with these smaller bites, and then you move up to affordable housing, and you move up from food to healthy food and things like that in your community. So it's ongoing, it's evolving. You don't have to take on everything all at once. So I think meeting basic needs should be a priority for all people in a community, including lawmakers. So starting there is an easy selling point.
I would also argue that you want to get the most bang for your buck with what you're investing in, and health is the basis for all these other things. So if you're investing in people's health and well-being in your community, you're investing in the economy, and you're investing in education, and you're investing in transportation and roads and all of those things if you can get people to be healthier.
What innovative approaches have you seen or used that have improved health outcomes in communities?
I would love to highlight recovery-friendly workplaces It's an innovative approach to the workforce shortage and also addressing issues that are related to opioid addiction or substance use disorder. The program allows us to educate employers on the importance of putting people back in the workforce who may have had challenges with substance use disorder previously, but also reducing stigma associated with substance use disorder while also building the economic capacity of our communities through workforce.
I would also like to highlight the diabetes prevention program that I hold in Monette, Missouri. It has been recognized by Missouri Hospital Association as a model program for prevention. And mainly because, all of the partners that we partner with, whether it's Missouri Health Senior Services, along with our local hospital, all of those connections and all of those collaborations have made that program a model program and very effective in our area.
Missouri is a leader in the partnerships with Extension and the professional schools. We started the Office of Health Outreach Policy and Education, or HOPE, in 2020, right before the pandemic. And it was actually perfect timing and a silver lining, in my opinion, to the pandemic, because we were able to be immediately on the ground with the expertise out of nursing and medicine and health sciences to bring the information that changed almost daily on the pandemic out through the infrastructure of Extension. People were able to hear and get their questions answered about the pandemic from trusted Extension faculty within their own community. There's lots of examples of how we got through the pandemic due to Extension. Since then, we have been able to bring resources from the professional schools out through the infrastructure to bring health screenings. And I think it's something that we can grow over the next several years and improve and start meeting the needs for the state, much like Extension has done for agriculture for the past 100 years. And I think that the potential is endless. And these solutions are all because of Extension.
Another project that was born from the pandemic was a virtual Stay Strong, Stay Healthy class. It's a strength training program that was created by MU Extension. And during the pandemic, we had a partner, the Kansas City Veterans Hospital, reached out looking for strength training for their whole health program. We were able to provide that utilizing the system that patients meet with their doctors through the VA. And because of that, we're able to reach veterans from about a 7 to 9 county radius and crossing into 2 states as well. So we're able to reach a much bigger network than we would have been prior to that.
I think something that's innovated that nutrition and health specialists within Extension do are we're kind of tasked with these policy systems and environmental changes. So we're really good at education. We can offer all these programs and educate individuals, but those policy changes within the communities are what really makes lasting changes, and they affect the entire community. So that PSE, or policy systems and environmental approach, is pretty innovative and affects more than just the individual.
The community health specialists worked for the past year to do community needs assessments that also included voice surveys, and they identified a cancer, an infectious disease, and a chronic disease, in addition to behavioral health issues coming straight from community members. And that data, they did it in 50 counties, and that data is now being used, for example, on an art grant through the School of Nursing. Community health specialists came on board in January of 23. It's a new position. There's one in each region of Missouri, and they bring expertise in many different areas, but education, nutrition, public health, and they're helping us to build that bridge between the professional schools and extensions. And it just gives us data of a starting point. And they're going to start addressing substance use disorder on a much bigger scale. And this is what Extension can provide the professional schools to address substance abuse, which is still an issue even with all the efforts that have occurred.
To capitalize on what Dr. Quinn has mentioned already, HOPE has been able to bring resources from campus to community. One example of that is our partnership that we are currently building with the Ellis Michelle Cancer Center. We're hoping that utilizing the data that our community health specialists have found will inform future opportunities for research, actually translational research, in addition to thinking about prevention and working across the continuum of cancer.
We have a really strong program in community gardening all across the state. There were more than 500 community gardens that were established just last year. And so those gardens play a big role in healthy food access, but we also use them to teach STEM. Many of them are located at schools. And so the students are involved in planting and in some cases in harvesting. We have some really cool examples of intergenerational gardens where we have older adults and students working together. And then the foods that they grow, they're more likely to eat. And it comes from the garden, so it should be healthy depending on how it's prepared. And so we're able to expose people to new foods that they grew themselves. There's a sense of pride in that, but also a lot of education that goes hand in hand.
I think the community gardens are a good example of that environmental change that we seek to do. So I had started a community garden in my field specialist role in Extension, and it was kind of bare bones. It was basic. It was me teaching simple gardening, simple fresh produce use and how to cook and how to eat and how to grow it yourself. The beauty of policy systems and environmental work is ideally it's long lasting and you don't need an extension person to carry that on forever. The community will take it over. And that's what happened. So year 2 and 3, I have no involvement in it. And the community has turned it into a massive, thriving garden where all the community members stop by, they chip in, they help, they get produce from it. They're teaching people how to cook it and eat it. They're donating it to food pantries, and that tackles food insecurity and things like that. So as long as it's empowering the community to continue that good work. That's what Extension does.
I think another innovative way that I've been able to integrate, healthy eating into my programs, a lot of the time people will say, well, eating healthy is expensive. The twist that I love to put on it, because I love gardening, is you could buy a packet of seed for $1 and plant it. Water it, provide it, with the nutrition that plant needs, and you'll be provided with tons of tomatoes or peppers for a whole season to come. And so that is how I combat, that stigma of like eating healthy is expensive and I can't afford it. And so, even with my participants who are past in my cohorts, they'll still give me a text and say, hey, the tomatoes that we learned how to grow are still giving me so much tomatoes, and the peppers, there's just so much that I don't know what to do with it. And so it's a great way to be innovative and saying, eating healthy and being healthy doesn't have to be expensive. It's very easy, and someone just needs to teach you or guide you on how to do it.
What role is Extension uniquely positioned to play in improving health and well-being in Missouri?
I think Extension has a really unique place in that we touch every county in the state. And in my work in the Urban East region, I work with a lot of different organizations because we have a lot of resources there. But none of those organizations, even ones that are whole statewide, don't have representation in every county in our state. So we have people on the ground who are able to build the bridge between community members and the institution, which is a trusted institution, to deliver education, research, and resources directly to folks.
I think there's a lot of power in extension in our faculty as conveners and facilitators. There are many partner organizations that we work with locally, all really kind of focused on health and well-being, but many times those organizations have limitations on the audiences that they can work with based on income or some other criteria. Extension doesn't. We work with everyone, and so that means that we can convene a large number of partners to work on a shared vision and drive community change for everyone.
I think extension is well structured, as in we have everybody in the counties, so we can affect the individual and community level. They're backed by the people at the state level with extension. Then they're backed by the university and the research that comes from it. Then they also have the UM system. So we have 4 universities worth of research that backs up all of this. And then we have organizations like MOCAN who bring in other community health organizations that aren't MU affiliated to work on one thing together, and it all affects everything with nutrition and health and physical activity and well-being, and as it trickles down. So Extension supports the State Nutrition Action Council, which is the Missouri Council for Activity Nutrition. MOCAN is what we call it. And its main purpose is to unite and collaborate with organizations from all over the state. So we have people from state departments, local health departments geographically spread all over the state, school board leaders. We have professors from other universities that are not within the UM system, some that are within the UM system. We have practitioners, and they all come together to work on nutrition and physical activity. They do it under the trusted source of MU Extension. We're that guiding leader in the research and the evidence and the trusted people within the communities as well.
I see my role in the field as connecting with community members, being that connection point between the community and the university, as well as someone who can gather other voices in the community, other leaders and community members to have conversations that can lead to change, where we can hear where the areas of opportunity may be, what people are hoping will change in their neighborhoods and communities. I went in with the mindset that I'm here to provide programming, but you don't do that very long without realizing that you're also there to be a connection point for people, a friendly face. When you look at it from the individual side, maybe a participant in our program, and you flip it a little bit, they come to us for the information, but they're also coming there for, again, that connection, that social interaction. The education is really a small part of it, I think, and then that leads to a trusting relationship. And so the people in our communities are really guiding us into that convener role that we fall into over time. It's sort of led by our community members.
I've always loved working with people and getting them the resources that they need to be successful, whether it's in their health or, their physical activity, and just really being a champion for them and cheering them on. That's how I see my field work, is because when I can be that constant person that they're seeing on a weekly basis to give them the education, the evidence-based research, and to just, show them you can do this. It's all of these things are doable. You just need a little bit of push and a little bit of support, being that support system for them in their life of change. Makes such a great impact on their success. And so that's what I enjoy the most about being in the field, is to be there and see their progress, their weekly progress over time. And before you know it, the year's done and they've made great changes and they've met great metrics.
Yeah, there's definitely opportunity to advance collaboration amongst organizations. We're hoping that the community health specialists will be able to feel empowered to be the voice of their community when speaking to and or convening different organizations for working together collectively for collective action.
And I think a good example is BI's Rural Immersion Program. And I'll let her explain the program, but we talked about workforce development and rural communities not having enough health providers. So everyone in a community understands that, not only the health access, but the economic benefits of having providers in their community. So Vi can talk about how she brings together community leaders to put that program on every year.
Yeah, so the Rural Immersion Program, it's a week-long program where we have medical students, healthcare students from all over Missouri come together in a rural setting where they can be immersed in what does rural look like. Some of them are from rural backgrounds, but different rural counties look different from others. And so they're able to, get a feel of what it would be like to practice in that area. What does living there look like? What does the community leaders advocate for when it comes to, workforce development in the hospitals or opening up practices in the areas. And so having that ability to get young minds, young professionals into rural communities at an early start can really drive that interest of practicing rural. And whenever we can get more healthcare students or practitioners into rural communities, they can fulfill the needs where there may be lacking resources, especially in specialties.
I worked for the School of Medicine for 25 years, and I worked for Extension for 5. I wish I would have known more and worked more closely with Extension my entire career, because the impacts that I made in the first 25 years with rural workforce was great. But working with Extension, the impacts on the students that are learning in the rural community from working through Extension to do their community projects, Extension's impact cannot be overstated.